Good morning, everybody. My name is Antonia Anoloha. I'm a DMP student from Brandman University. I'm in the class of Dr. Clary, DMPU 705. I'm here to present Proactive Health Communication Campaign. Overview is uncontrolled hypertension. Hypertension is a symptomless condition that damages blood vessels and leads to serious health problems if it is not adequately managed. Approximately half of US adults develop hypertension, which is defined as systolic blood pressure equals to or greater than 130 or diastolic blood pressure equals to or greater than 80. According to CDC, about half of US adults have uncontrolled hypertension of 140/90 or higher. Uncontrolled high blood pressure is the leading cause of stroke, heart failure, heart attack, renal failure, and premature death. The risk factor that contributes to uncontrolled hypertension including medication non-adherence, smoking, obesity, stress, lack of exercise, excessive salt and alcohol intake. The topic is antihypertensive medication adherence, which is one of the management of hypertension. And other management include increased physical activity, smoking cessation, stress, and weight management, healthy diet, low salt and alcohol consumption. Antihypertensive medication adherence, agenda identifying the population at risk, describing health risk, describing the health promotion, importance of medication adherence, theoretical framework, multimedia approaches, resources, references, and a question. Population at risk. I live in Culver City. Culver City is a city in western Los Angeles County, California, with a population of 40,351. The city of Los Angeles surrounds Culver City. Approximately more than half of the adult population has hypertension, age 20 to 75 years, that is uncontrolled. Health at risk. Health at risk is uncontrolled hypertension. Uncontrolled hypertension is the major risk factor for heart diseases, stroke, and the fifth leading cause of death in the United States. In 2016, 82,735 deaths were attributed to uncontrolled high blood pressure. The total cost of uncontrolled hypertension were $55.9 billion in 2015, and the estimated cost by 2035 will be $220.9 billion. Uncontrolled hypertension adds extra burden to the patient, family members, and caregivers. What is happening? What is happening is that most of the patients are non-compliant with their medication. And with the use of flyers, telemedicine, including text messages, phone calls, and visual classes, will help to educate people about hypertension and its complication and the importance of medication adherence. The importance of antihypertensive medication adherence. Patient adhering to medication and positive lifestyle behavior reduces hypertension complication, including heart failure, kidney diseases, premature death, and healthcare costs. And what is this medication adherence? Medication adherence is taking medication as prescribed and adopting lifestyle modification recommended by the healthcare provider. Healthcare theory. I adopted Dr. Dr. Faye Abdullah's theory of 21 nursing problems, which is a conceptual model concerned with patients' need and nurses' role in identifying the problem and using health educational information to solve or reduce the problem. The 21 nursing problems are divided into 3 major categories. The problems common to the patient, physical, psychological, and sociological needs of patient, interpersonal relationships between nurses and the patient. Dr. Abdullah's theory applies to my clinical scholarly project, the use of telehealth education to improve medication adherence for African American adults with hypertension. Multimedia approaches to improve medication adherence include phone calls as a reminder system, text messages as a reminder system for them to take their medicine, visual classes to educate patients about the importance of their medication, infographic to help them to understand the importance of medication adherence, daily pill set up to help them to take their medicine daily, electronic medical records to identify patients that are non-compliant and help the patient, flyers about hypertension, complication of hypertension, and medication adherence. This is the flyer I developed regarding regarding what is high blood pressure, what should one know about taking medication, how can one remember to take medicine, what type of medicine may be prescribed, and what are the side effects of the medicine, and also complication of uncontrolled blood pressure. And the other flyers talk about lifestyle modification, take medication as prescribed, healthy eating, maintaining healthy weight, smoke cessation, increase physical activity, limit salt intake, reduce alcohol consumption, and keep doctor's appointment. This is another multimedia example: patient-provider communication and interprofessional collaboration. Patient-provider communication helps the provider to understand why a patient is not adhering to the medication, which might be as a result of their belief, fear of the side effects of the medication, forgetfulness, cost, and uninsured. And here now the provider will collaborate and communicate with other healthcare workers such as social worker, case manager, discharge planner, and the pharmacist to help this patient to comply with their medication. The goal of Healthy People 2020 is to improve high quality care, promote health, prevent disability, and premature death. And this is another multimedia example: community engagement involving stakeholder, educating the stakeholder the importance of medication adherence, the complication of uncontrolled hypertension, and the use of webinar to communicate with the community and the community advisory board about hypertension, its complication, and medication adherence. This is resources part about hypertension from CDC. Small changes will make a big difference in managing your blood pressure, from American Heart Association. Health and Social Services in Culver City. What is high blood pressure? From American Heart Association. My email is aanuluoh@mail.brandman.edu for any question. Thanks for watching and listening to my proactive health communication campaign. And this is my references.